Big Biz Show rolls on in over 175 countries, all the ships at sea. You can hear us on the American Forces Radio Network, and as always, a shout out to the brave men and women of our United States Armed Forces, what they do for us. Shout out to the day Trader Quattro right there, all four, live and in person. No lessons. They just picked up the instruments and started playing at this level. It's a miracle in music. Back here at the bar, it is Costa and Mary Burt Godwin. Mary, Sully is going to be so mad that he's missing our next guest.
Yes, he is.
Because he and I both fight. And we all should be more aware of skin cancer and things like that, and we're not. But he and I both have fought the battle. I know that he recently...
He had a big one on his head.
He had a big one on his head, yeah. It was called a brain, and they took it out of his skull. Anyhow, that's a story for a different day. But joining us for the very first time here on the Big Biz Show is Mr. Joe Sardano. He is the CEO of Sensus Healthcare. Their ticker symbol is SRTS. Joe, on behalf of everybody, welcome to the Big Biz Show. How are you, sir?
I'm very good. Thank you for having me.
Absolutely. Thank you for the time. Joe, I guess to begin with, just kind of give us the nickel version or the overall view about what Sensus Healthcare is all about.
Yes, we are a medical device company that manufactures a very unique technology called Superficial Radiotherapy, also known as SRT. And we have been in existence for approximately 16 years now. We went public about 10 years ago. This technology is unique in that, unlike other radiation devices like electron beam, which is what is known to treat breast cancer, lung cancer, and all the other cancers, and it goes right through your body and kills everything in its place.
Yeah.
Photon radiotherapy is what our existence is all about. And that is very unique technology in that the radiation only penetrates about 5 millimeters below the surface of the skin, kills all the skin cancer cells while it allows the healthy cells to survive and continue to grow. So it's very unique to skin cancer. It's extremely effective. And right now it's the #1 non-invasive treatment choice by patients and physicians to treat skin cancer, with a 99% cure rate, which is the same as Mohs surgery, which is what everybody knows today.
Joe, before we go on and talk about the Mohs surgery versus your therapy, et cetera, is this something that you always were thinking about with Sensus Healthcare, or what was the genesis of what you do, I guess is the best way to ask it?
Well, it's funny how you fall into things, but I'd been in healthcare for over 40 years based on devices, introducing devices as far back as 1980, introducing MRIs into the marketplace. And then most recently with General Electric Healthcare, introducing positron emission tomography, or PET-CT, which is the #1 equipment to identify cancer anywhere in your body. But I knew that I wanted to do something on my own. I wanted to find a way to be involved in either oncology or cardiology. And I fell upon skin cancer. I couldn't believe how big skin cancer was and how no technology had entered this field for the last 50, 60 years, that they relied on a surgical choice to treat the skin cancer. And in anything else in healthcare, technology has always been involved. And usually surgery is the last choice these days, not the first choice. So we went into the market very cautiously, optimistic about what this technology can do. And we learned from the Mohs surgeons that they cannot do surgery on everybody. There were pre-existing conditions with patients. And so that's how we launched the company, working with this technology with the Mohs surgeons, who are the experts in skin cancer, and combining the two technologies, working together to provide a comprehensive solution for their patients.
Joe Sardano is the CEO of Sensus Healthcare. Their ticker symbol is SRTS, joining us for the first time here on the Big Biz Show. Mary?
Yeah, hey, Joe, nice to meet you. And that was part of my question was, does this treatment work in tandem with Mohs? And how does it work? You know, is it a one-time treatment, or do patients keep coming back? Is it multiple in the day, or what does that look like for a patient?
Yep. Well, the FDA indication is to treat non-melanoma skin cancer, which means that we don't treat melanomas, but we do treat basal cell and squamous cell, which represents 98% of all the skin cancers. Wow. So it's an either-or proposition for the patients, whatever their choice is, depending on pre-existing conditions and what the physician would advise them to do. but they come in multiple times, probably 3 or 4 weeks, a couple of treatments per week for the treatment. And the neat thing about it is because there is no surgery, there is no cutting, there is no bleeding, there's no stitching, and most of all, there's no scarring. And that's what's unique for the patients. And on top of that, now being in the market for umpteen years, there are no side effects as well. So this is very encouraging for the patient, and they love the fact that they don't have to have surgery.
And is it any place on the body where skin cancer might be, or are there places where it might show up like the scalp or something? I don't know. I'm just saying one.
Well, that's a good point, because 80% of skin cancers are on your head, neck, or face. So all of these areas like your lips, your nose, the crevices around your eyes, your ears, it's all real important because surgery can be quite invasive.
Yeah.
And for instance, we've all been in the ballparks or playing tennis or whatever. We wear our caps and so on to protect us from the sun. But somehow we come back home and we've got a red nose.
Yep.
We've got a burn on the nose. And consequently, because of that, 31% of skin cancers are on the tip of your nose.
Yep.
And what they have to do to correct that surgically is they literally fillet your nose in half, take skin from your forehead or from your butt, and put it on there and repair it the best that they can. But irregardless, you're going to have a scar.
Joe Sardano, CEO, Sensus Healthcare, SRTS. You know, Joe, I'm so excited that you've come on the show at this juncture, because just in the last couple of months, I had 2 Mohs procedures, one on my cheek here under my eye and one back here on the neck, which was really serious. And for those of you who don't know what that is, your dermatologist basically carves you up like a turkey, patches you up. You have to go wait in the waiting room. They read the boundaries of the sample they took, and either they come out and say, hey, we got it, not a big deal, or come back in, I got to carve on you a little bit more. Is it a situation, Joe, where I can now call my dermatologist, like I'm going to do after the show, and say, hey, Sensus Healthcare has got a different way to go about it, doing it. Can you please get on board? Are a lot of dermatologists getting on board with it?
A lot of dermatologists are getting on board with it. I would suggest this. You need to go to the doctors that are going to provide their patients with the choices that they need to treat their ailments.
Okay.
So you're always going to find a doctor that has both, one who does Mohs surgery as well as offering superficial radiation therapy. If you go to a doctor who only does Mohs surgery, guess what you're going to have? You're going to only have Mohs surgery, and you're going to have scarring. So there are many Mohs surgeons out there that have this product. So you have choices. You can choose the doctor you go to, and my suggestion is go to the doctor who cares the most about you by offering you the most choices possible to treat your skin cancer.
Hey, Joe, before we let you out of here, it looks like maybe you're getting some more reimbursement codes from Medicaid and Medicare, so some of this is taken care of?
Big opportunity for us, for the company, and for our doctors. As of January 1st, Centers for Medicare and Medicaid Services provided our technology and our doctors exclusive rights to a CPT code or reimbursement codes that provides reimbursement for all patients, Medicare patients, and so on. So this is covered by Medicare. Patients shouldn't have to worry about getting it paid for. And I guess it's a revelation by CMS saying that this is a technology that we want involved in treating skin cancer, not just Mohs surgery.
Amazing.
Look how successful he is. He has his own spaceship where he's doing the interview from today. That's how on point Joe Sardano is. CEO, Sensus Healthcare, SRTS. Joe, will you come back on the show with us, please? We'd love to follow this path and continue to watch your excellence as you help people deal with skin cancer. Joe Sardano, CEO, Sensus Healthcare, SRTS is the ticker symbol. All right, keep it here. Much more to come with the Big Biz Show.